Welcome to Boston Community Health. I'm Dr. Elias Thorne. Today, I will reveal an astonishing medical truth. After the age of 70, some of the most common routine medical checkups can actually cause significantly more harm than good to your body. Imagine you are 74 years old, feeling excellent, sleeping well, and possessing great energy, while quietly enjoying your independent life. You go in for a routine annual physical, and your doctor glances at your chart, saying, "Let us run a few tests, just to be safe." 6 weeks later, you find yourself sitting inside a surgeon's office, not because you felt sick, but because those, just to be safe, tests found a tiny abnormality. That finding triggered a devastating chain of medical events, which completely overturned the peaceful life you loved. This exact clinical scenario plays out far more often than the medical establishment likes to admit publicly. My mission is to help adults over 60 understand what the actual research evidence proves, using plain language. The core truth is that after age 70, the delicate risk-to-benefit math of screening medicine alters dramatically. But unfortunately, nobody is doing that mathematical calculation with you inside the exam room, forcing the automated system to push your body into highly risky, unnecessary overtreatment. Today, I will guide you through 5 specific routine checkups I would personally reconsider after age 70. First, you must fully grasp a core clinical concept that I call the longevity lens. At age 50, routine screening works beautifully, identifying problems early to buy you 30 more healthy years. But after 70, many detected conditions grow so slowly that you will naturally outlive them, yet, once visible on a medical report, the clinical machine automatically activates the treatment button. Before moving forward, take a second to click like, subscribe to Boston Community Health, and comment your name below. Invasive interventions at age 78 often trigger a devastating cascade effect, all started by one unnecessary test. We begin with checkup number 1, routine colonoscopy screening after the age of 75. Consider the real-world case of Dorothy, a 77-year-old retired librarian from Tennessee. She underwent 2 colonoscopies in her 50s and 60s, both returning completely clean, showing 0 polyps, no family history of colorectal cancer, and no symptoms. However, her new primary care physician glanced at her checklist and insisted she was due for another invasive scope. Dorothy did not want to appear difficult, so she agreed to go. But the intensive bowel prep, the liquid formula you must consume the night before to completely clear your digestive tract, hit her kidneys severely. By the next morning, she was deeply confused, dizzy, and physically unable to stand. Her daughter rushed her to the emergency room due to severe dehydration. Her electrolytes dropped to levels that put her heart at immediate risk. Dorothy spent 4 days hospitalized and never had the procedure. The clinical irony is that the United States Preventive Services Task Force officially recommends against routine colonoscopies for average-risk adults over 75, due to a 1 in 500 risk of bowel perforation. A bowel tear in a young adult is a manageable surgical complication, but at age 77, it means emergency surgery, a colostomy bag, and a recovery that permanently destroys your quality of life. Furthermore, colon cancers detected at this stage grow remarkably slowly. Ask your doctor instead about non-invasive stool-based alternatives like Cologuard or annual FIT tests. These successfully flag genuine warning signs without carrying any procedural perforation risks. Checkup number 2 is aggressive cancer screening using annual PSA prostate tests and mammographies for low-risk patients. Let me be precise here, I am not telling you to never check for cancer. However, after age 75, aggressive cancer screening in asymptomatic individuals leads directly to overdiagnosis and overtreatment. If you find this helpful, please click like and subscribe right now. Modern imaging technology is so sensitive that it easily detects tiny tumors that are biologically asleep. Left alone, they would never spread, never cause symptoms, and never shorten your life. But the moment a radiologist writes the word malignancy, the clinical machine forces you into painful biopsies. Consider the case of Richard, a 79-year-old retired mechanic from Georgia. He was sharp, independent, and still enjoyed fishing on weekends. A routine PSA test came back slightly elevated. The biopsy confirmed a low-grade, slow-moving prostate cancer. His urologist recommended radiation therapy, and Richard trusted the advice. Within a single year following treatment, he was dealing with chronic fatigue, severe urinary problems, and a quality of life that dropped dramatically. Studies published in the New England Journal of Medicine confirmed that a substantial portion of cancers detected through mammography in women over 70 offered zero survival benefit from treatment, leaving only side effects. Instead of screening blindly, ask your doctor directly, if we find a tumor, what are the realistic treatment options at my age and the risks? That question alters the conversation. Now we move to checkup number 3, routine cardiac stress testing without symptoms. Many older adults follow advice to run this test just to make sure the heart is doing okay. You hop on a treadmill, or they administer a medication to temporarily stress your heart. It sounds perfectly responsible. But in reality, cardiac stress tests in people without symptoms carry false positive rates that reach 40%. This means nearly half the time, the test flags a critical abnormality when your heart is actually perfectly fine. That false alarm immediately launches your body into the next phase, a cardiac catheterization. This is a highly serious invasive procedure, threading a thin tube through your wrist or groin directly into your heart, carrying risks of bleeding, vessel damage, arrhythmia, or stroke. Worse, if catheterization identifies a partial blockage, which is extremely common in adults over 70, you may end up with a cardiac stent alongside a lifetime of blood thinners and bleeding complications. Multiple landmark clinical trials, including the widely cited ischemia trial, proved that stenting in patients with stable coronary disease did not reduce heart attacks or extend life compared to medication and lifestyle management alone. You go from feeling perfectly fine, into a loop of tests, false alarms, catheterization, stents, and dangerous blood thinners, while gaining no survival benefit over someone who simply walks 30 minutes daily. If you have no chest pain, or shortness of breath during activity, skip routine stress tests and focus on managing blood pressure at home. We move to checkup number 4, routine bone density DEXA screening followed by automatic long-term medication. This topic makes many individuals uncomfortable when I bring it up, because osteoporosis is entirely real, and falls are devastating in older adults. I am not questioning the reality of biological bone loss with age. What I am questioning is the automatic clinical pipeline that often follows a DEXA scan result in patients over the age of 75. You take medications like alendronate for years assuming your body is protected, but long-term bisphosphonate use has been linked to a serious condition called atypical femoral fractures. If you find this video helpful for your family, please take a moment to click like, subscribe to Boston Community Health, and leave a comment below sharing your experience. Your interaction actively helps the algorithm spread this vital medical knowledge to protect more seniors. These severe stress fractures occur spontaneously in the thigh bone, the very bone you were trying to protect. Additionally, these medications are linked to osteonecrosis of the jaw, causing severe bone deterioration. Meanwhile, the most effective intervention for preventing bone fractures in older adults is not a pill, but structured fall prevention. Clinical studies show that practicing Tai Chi specifically reduces your fall risk by nearly 50%. Removing tripping hazards from your home, installing sturdy bathroom grab bars, checking medication side effects causing dizziness, getting regular vision exams, and ensuring adequate dietary protein and vitamin D, reduce fracture risks more meaningfully than any pill with zero side effects. I am not saying never take medication for bone health. There are absolutely patients who need it, especially those who suffered prior fractures or have very low T-scores. But a routine DEXA leading to automatic long-term medication for an active 74-year-old who has never broken a bone, is a conversation worth having, not a foregone conclusion. Before accepting a prescription, ask your doctor, can we review my fall risk factors first, and what is the actual fracture reduction from this pill compared to balance training? Checkup number 5 is asymptomatic carotid artery ultrasound screening. This is the test almost nobody talks about publicly, and based on what the research shows, it is one of the most quietly consequential. The core idea of a carotid artery ultrasound sounds highly logical and simple: Check the large blood vessels in your neck carrying blood to your brain. If a significant blockage is found, surgeons can surgically clean it out to reduce your stroke risk. Sounds perfect, right? The medical reality is far more complicated, and for asymptomatic patients, far more dangerous than it appears. The surgical procedure utilized to treat this carotid blockage is called a carotid endarterectomy. The terrifying fact is that this surgical procedure to clear blockages carries a 2 to 3% risk of causing a stroke during or immediately after the operation. In older adults with other health conditions, that statistical risk is much higher. The United States Preventive Services Task Force explicitly recommends against routine carotid artery screening in adults who have no symptoms, no history of mini-strokes, or sudden vision loss episodes. Their official analysis found that in asymptomatic people, the risk of surgical harm heavily outweighs the benefit. Many individuals over 70 have some narrowing in their carotid arteries, but that narrowing is stable, silent, and harmless. When you screen for it routinely, you find it, and then a well-meaning surgeon recommends fixing it immediately. But the invasive surgery to fix a blockage that was never causing symptoms, can, and sometimes does, dislodge a tiny piece of plaque that travels directly to your brain, causing a severe stroke. The medical literature shows individuals walking into a routine screening appointment perfectly fine, and leaving on a completely disabled trajectory, not because of the blockage, but due to the intervention. This neurological damage happens not because of the blockage itself, but entirely due to the unnecessary medical intervention that followed. If you have no symptoms of stroke like sudden facial drooping, arm weakness, or brief vision changes, routine carotid ultrasound is generally not recommended. The far better investment is in controlling the actual modifiable risk factors at home, including high blood pressure, the single biggest stroke driver, blood sugar, and atrial fibrillation management. To help you take complete control of your next doctor appointment, I want to provide a practical framework called the 5-question protocol. Write them down, put them in your phone, and bring them to every physical checkup. Question number 1 to ask your doctor is, what is the false positive rate of this test in people my age? This tells you how likely the test is to trigger unnecessary follow-up procedures, even if nothing is actually wrong. Question number 2, if this test finds something, what are the realistic treatment options for someone my age and health status? This crucial question forces the medical conversation toward actual outcomes, not just automatic findings. This forces the medical conversation toward real clinical outcomes, rather than just filling out check marks. Question number 3 is the one most people never think to ask. What is the procedural risk of any treatment we would likely pursue? Every single procedure carries a risk. You deserve to know it fully up front. Question number 4. What happens if we choose to monitor this condition closely instead of pursuing immediate treatment right away? For many slow-moving conditions in older adults, watchful waiting with regular medical monitoring is a legitimate, highly safe, and often superior clinical option compared to rushing into invasive surgery. Now, bring up question number 5. What is the most effective non-invasive intervention for this condition? Because very often, as with bone density, heart health, and stroke prevention, simple lifestyle adjustments and basic medications heavily outperform procedural interventions with far less risk. Any good, highly competent physician will completely welcome these 5 questions from you. They will respect your intelligence and appreciate your self-advocacy. If your physician dismisses these questions or makes you feel difficult for raising them, that is important diagnostic information proving that doctor is simply not the right fit for your long-term healthcare journey. I want to close with this profound clinical philosophy. There is a major difference between medicine that finds things, and medicine that actually helps you live well. After age 70, the ultimate goal of your healthcare should not be generating a checklist of abnormal findings. The ultimate goal of your healthcare at this stage must be protecting and extending your actual quality of life, preserving your independent living, your daily physical energy, and maintaining your capability to do what truly matters to you. The finest geriatric physicians I have ever known throughout my medical career, fully understand a profound truth that choosing to pursue fewer invasive interventions often requires significantly more clinical wisdom and deep consideration than simply ordering more procedures. Recommending a strategy of watchful waiting with active monitoring, consistently requires far more clinical courage than automatically ordering another complex diagnostic scan. You possess every single right to know exactly what a screening test is looking for inside your body. You have every right to understand what happens next if an abnormal finding is discovered on the report. You have the absolute right to ask whether a finding would actually be treated, and whether that treatment would genuinely improve your life. Modern medicine has provided humanity with truly incredible diagnostic tools. But tools are only helpful when they are utilized in the right context, at the right time, and for the right person. You might experience dozens of microarousals across a single night without your conscious mind ever realizing it, but your vascular system notices every single one. Every time a loud sound occurs, your heart rate instantly spikes, and your body releases the stress hormone, cortisol. Cortisol constricts your blood vessels and causes your blood pressure to rise suddenly in the dark. To eliminate this hidden variable completely, consider utilizing a white noise machine or professional earplugs. Now, there is an incredibly low-cost home monitoring tool capable of saving your life that I recommend every senior invest in, an overnight pulse oximeter. This small clip-on device continuously tracks your blood oxygen saturation throughout your entire sleep cycle. If your tracking data shows your oxygen regularly drops below 92%, that is a serious warning sign you must immediately bring to a formal conversation with your primary care physician. This oxygen drop is often clear evidence pointing directly to obstructive sleep apnea, a chronic condition that multiplies your stroke risk and severely damages aging blood vessels if left untreated. This is highly valuable real-world clinical data that your physician will actually want to evaluate for accurate diagnosis. What I need you to understand deeply from this video is this: your risk of suffering a stroke does not clock out when you fall asleep. In many medical ways, the quiet hours between midnight and dawn are the most critical and decisive hours within your full cardiovascular day. The beautiful part is that your body position during those critical hours is something you possess direct, immediate, and zero-cost control over. You do not need to wait for an expensive prescription or undergo painful procedures. You just change how you place your body down on the mattress tonight to protect your own life. Please select just one single action item from today's checklist to start implementing immediately tonight. You can switch to your left side tonight, or elevate your upper torso 15 degrees. Any single adjustment is not a small thing, it represents a consistent nightly intervention that compounds over time. You are that specific person, and you thoroughly deserve a comprehensive healthcare experience that is built around your individual life goals, your personal values, and your unique body, rather than an unfeeling automated checklist. If today's video gave you a new way of thinking, a scientific lens to reconsider your health after age 70, take a second right now to scroll down and save these 5 critical questions into your phone. Write these 5 questions down on a physical sheet, or store them inside your phone app to bring into every future medical appointment. Additionally, I genuinely want to hear from your real-world experiences. Please leave a comment right below this video to share. Have you ever undergone a routine screening test that unexpectedly led your body into a loop of overtreatment? Your real personal stories serve as highly valuable medical insights for this growing community. Sometimes, reading your personal story of navigating through a medical cascade effect is exactly what someone else in this community needs to find the courage to advocate for their health. That self-advocacy can save their physical independence before it becomes too late to turn back. If this information helped you today, please help the algorithm spread this video by clicking the like button, and share this link with the people you care about most. Send it to a spouse, an aging parent, or a colleague over 70, individuals who are preparing for their annual physical checkup without knowing these dangerous hidden clinical risks. The person who is currently at risk of being harmed by automated overtreatment will likely never search for these critical medical studies online. Your small act of sharing today could be the exact reason someone avoids an unnecessary high-risk surgical procedure, preserving their physical energy to live well. I am Dr. Elias Thorne from the trusted medical organization Boston Community Health, dedicated to supporting your journey toward highly informed health autonomy. Now you are fully equipped with the longevity lens and the 5-question protocol to master your medical destiny. Always stay sharp, stay highly informed, and protect your body wisely. Please click like, and subscribe to Boston Community Health right now to catch next week's video on major red flag vascular warning signs. Thank you, wish you continuous longevity, and see you next time.